high maintenance to become low maintenance. Now, what does that mean?
Welcome to the center. My name is Dr. Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel.
In 2024, people are going to be looking much more to have plastic surgery in order to look natural rather than look like they've had stuff done. Hi, I'm Dr. Azizzadeh, and I'm a facial plastic surgeon in Beverly Hills. So in 2024, here are 6 things that will be trending in plastic surgery. Number 1, aesthetic maintenance. It's going to be all the rage. What does that mean? Whether you've had previous plastic surgery or not, aesthetic maintenance means just maintaining your natural, authentic, flawless beauty. Everyone has beauty, and the maintenance of it is actually pretty simple. So aesthetic maintenance means you're going to take care of your skin really well. Great skincare regimen. You're going to do subtle Botox, not overly aggressive Botox. You're going to do subtle fillers, or maybe actually reverse poorly done fillers. You're going to do firming treatments such as radiofrequency, Silfirm, Morpheus, and you're going to just maintain a really great healthy lifestyle. Number 2, the buccal fat pad craze will calm down. I think last year there were so many articles and information about buccal fat pad. At the end of the day, people didn't know whether they should be removing the buccal fat pad or not. And basically the buccal fat pad is this little pocket of fat that extends from the temple all the way to the corner of the mouth. And if it's overly enlarged or if it's really low in the face, it can create an aesthetic imbalance. Ultimately, we don't want to overdo anything with a buccal fat pad, but we do want to be judicious in terms of how we manage it, modify it, reduce it, elevate it, reposition it. Now that the trending and the articles are not going to be out there, I think we're going to see less and less people coming in and asking for the removal of buccal fat pad. And most people don't need it removed. So right now, really, you have to be very thoughtful about what you do with a buccal fat pad. My recommendation with a buccal fat pad, it's always individualized. And removal of an excessive amount of it can leave you very hollow. But it is a beautiful operation if it's done correctly, especially when it's repositioned, that can give you a beautiful high arched cheekbones and a very slimmed lower face. Number 3, the use of fillers is going to change. It's going to become much more strategic and much more subtle. In fact, I think a lot more people are going to be dissolving fillers than ever before, because fillers we utilize to replenish lost volume. But when it's used incorrectly in the wrong place, in the wrong plane, and over injected, it can actually cause distortion to the face. And that's why a lot of people we see have fully rounded face. We call it pumpkin face or duck lips. The trend is moving away from that. We want beautiful, aesthetic, natural, undetectable filler use. And to do that, it really requires a lot of artistry, and it requires a lot of restraint, because a lot of doctors get asked all the time, I want more fillers, and they have to guide their patients in reducing the utilization when it's not necessary. I love fillers, and I use it all the time, but using it in a very strategic, subtle way is the way to go. Number 4, facelifts have already been trending. I think that trend is going to continue. And I think the trend is going to continue for the deep plane facelift and the deep neck lift, because the results are phenomenal when it's done correctly. The aesthetics are natural and undetectable when it's performed correctly. And I do believe that this trend will be significant over the coming years, and especially in 2024. The deep plane facelift basically utilizes the deeper tissue layers and the deeper muscles to reposition the tissues. And when it's done correctly, it is beautiful and gorgeous. Traditional facelifts utilize the skin and just a little pull and tug of the deeper tissues. So it didn't give that natural look or the longevity of a deep plane facelift. However, with deep plane facelifts requires a significant more expertise by your surgeon because nerves are in that area, the tissues can get damaged, so it really does require a high level of expertise of understanding the facial nerve anatomy, understanding the deeper facial anatomy and the fat anatomy. I love the deep plane facelift and the deep neck lift. However, be cognizant, be careful with a surgeon that will be performing this. This requires a super specialist, someone who does this all the time, who is really, really great and has very low risk of causing complications. Number 5, the use of fillers in the lips will slightly go down, not completely, and the use of lip lifts to get a beautiful result will continue trending up. Lips are probably one of the most important areas for our attractiveness. Volume in the lips, everybody loves it. There's nobody that says, I want thin lips. Everybody wants voluptuous, voluminous lips. However, how you achieve it and the way that it's done is critical. Some individuals and some doctors overutilize fillers and create a very unnatural duck-like lips, and it's just unattractive. However, lip lifts, which basically shortens the upper part of the lip and brings out the lip, in some patients, not all, not everyone's a candidate, can give a really beautiful natural aesthetic. And sometimes an individual doesn't need fillers, they need lip lift. Some people don't need lip lift, they need fillers, and some people need both. So the understanding of the artistic approach to the lips is critical. Over the year of 2024, I do believe that the use of lip fillers in the lips is going to become a little bit less trendy, and use of lip lifts will become more important. So my recommendation, as always, is you got to individualize it. These are not procedures that are cookie cutter and anyone can just put fillers in. I love fillers in the lips, I love lip lifts, but you have to use fillers judiciously, conservatively, and you got to use lip lifts safely and conservatively as well. And last but not least, the giant, the behemoth of all treatments in facial plastic surgery, Botox, will continue to dominate. Botox continues to give amazing results, give us outcomes that other procedures can't replicate. And I do believe with the continued popularity of plastic surgery, it will continue to rise. And now we have a lot of choices of what products to use. Botox, which is the product that's been around for a long time, and Daxxify are duking it out. Daxxify is a newer toxin that has been shown to get really, really great results for fine lines, all the things that Botox does. And perhaps it lasts a little bit longer. We're still waiting to see how long and what the popularity and what the longevity is. But regardless, both products are excellent and we will continue to see this trend. So for the individuals who are looking to have toxins to reduce wrinkles around the eyes, 11 lines forehead, we use it in the neck, we use it in the masseter, we use it to turn the corner of the mouth up. There's so many options of utilization. There are 4 products currently that are really popular and are on the market: Botox, Daxxify, Dysport, and Xeomin. Every doctor uses these products in a different way. So go with what your doctor really likes to use because they probably have perfected the way that they use each product. And overall, they're all effective, they all work well, and results are very safe and outstanding. And as far as toxins goes, I love toxins. It's been around a long time. They're safe, they're effective, and patients love it. That's why it's the #1 product that people utilize in the aesthetic space. 2024 is going to be an exciting year in the aesthetic space. I think there's a continued evolution of getting subtle, authentic, undetectable results. I think people are going to want that. I think there are certain procedures, both surgically and non-surgically, that will continue to trend up and some that will trend down. But overall, I think the excitement and the outcomes are going to continue to get better and more outstanding. So I look forward to 2024. Thank you so much for watching this video. Please like, comment, and subscribe. And please let us know what you think will be trending or what procedure you are interested in or you've been thinking about. Please also follow us on our social media accounts on Instagram, TikTok, and we look forward to a great 2024.